Okay, welcome everybody. We're going to start quick and hopefully go hard. There's a lot of stuff that we're going to cover tonight, and I hope this is going to answer a lot of questions for you. So one seed I want to plant in your head tonight is that we talk about shortness of breath all the time, and we talk about the fact that shortness of breath is multifactorial, meaning that it's not just the respiratory system that either makes you breathe better or breathe worse. It's the cardiovascular system, it's the neurologic system, it's the musculoskeletal system, and many, many other factors, things like weather, things like anxiety. All these things can contribute to either helping you breathe better or breathe worse. And I want to keep that in mind as we move along. And another concept that I want you to think about as we move along as well is the delineation between what is disease, what is actually being caused by the disease, what is simply a symptom that may or may not be caused by the disease, and what is a side effect or something corresponding that sort of comes and sort of bundles up. Because what happens a lot of times with shortness of breath, as you know, is that it sort of snowballs. So very often people get short of breath at high levels of exertion. So in New York City, the things that I hear most often are walking uphill, climbing subway stairs, or running for a bus. And the common ground between those three activities is that they're all high levels of activity. So we're going to judge a high level of activity by how much actual muscle do we have to use, how much does the heart have to work, how much air does the respiratory system have to bring in and out. So another concept that I want to bring to you and that you should think about for this whole night is really supply and demand. Because the higher level of the activity, the greater the oxygen demand, and therefore the greater supply we have to provide. So for people who have any type of lung disease, and it doesn't matter if it's a restrictive disease like interstitial pulmonary fibrosis, or sarcoidosis, or obstructive disease like COPD, emphysema, chronic bronchitis, asthma, it doesn't matter. The key component is that there's shortness of breath, and anytime you're short of breath, that means that the delivery system is going to be impaired. So let's just talk for a second about the differences between obstructive and restrictive disease, because this is a question that I get asked a lot by people. They want to know, do I have obstructive disease, do I have restrictive disease, and what is the difference between them? So just from the audience, does anybody know the difference between obstructive and restrictive disease? Okay. So when we talk about obstructive lung disease, okay, we are talking about the fact that there's an obstruction to exhalation, meaning that air coming in is not a problem. Air going out is the problem. So when we talk about obstructive diseases, we're talking about things like asthma, COPD, chronic obstructive pulmonary disease. And when we talk about chronic obstructive pulmonary disease, keep in mind that we're talking about two main diseases. Those two main diseases are chronic bronchitis and emphysema. So a lot of times people come to me and they say, well, I have COPD, but I don't have emphysema, or I have emphysema, but I don't have COPD, or I have chronic bronchitis, but I don't have a COPD. And so I think that that's something that a lot of people don't understand. So when we talk about COPD, we are talking about two major diseases, okay? Emphysema, which is disease of the small airways in the alveoli, which are the air sacs where gas exchange occurs, and we're talking about chronic bronchitis, which is disease of the larger airways or the bronchi. Okay, so that's COPD. So if you have chronic bronchitis, you have COPD. If you have emphysema, you have COPD. But you can have COPD and not have emphysema if you only have chronic bronchitis. And you can have COPD and not have chronic bronchitis if you only have emphysema. But the majority of people have a combination of both large airway disease and small airway disease. So again, obstructive disease, there's an obstruction to blowing air out. And so as a result, people with obstructive disease often wind up with larger lungs, okay? Because the lungs inflate, but the usual recoil that the lungs have is impaired. So you wind up with a larger lung and a bigger chest, okay? As opposed to restrictive lung disease, where the restriction is going to be to inhalation. So restrictive diseases are things like pulmonary fibrosis, interstitial lung disease, sarcoidosis. Okay, so in cases like that, The problem is that the person has trouble taking a deep breath in. So exhalation is not a problem. So in fact, the recoil of the lungs is very strong, and the lungs are so tight that to actually take the breath in is the difficult point, okay? Now I want to make a comment, because very often, and even in response to the first couple of webinars that we did, there were people who were writing and making comments or sending suggestions and saying that you mainly addressed obstructive disease and there wasn't really much for restrictive disease, or you didn't really talk about breathing for restrictive disease, but you talked about obstructive disease, or breathing in for 2, out for 4, or it's the same old thing for COPD breathing. I just want to be clear about something, okay? Shortness of breath is shortness of breath, and there's no one thing that's going to work across the board for every person. Likewise, not every person with obstructive disease is going to benefit from the same breathing techniques, and likewise, not everybody with restrictive disease is going to be benefiting from the same breathing techniques. But I think that it's really important that we understand that shortness of breath is the key component here, okay? So it doesn't matter if you have trouble breathing air in or if you have trouble breathing air out, because a problem with one is going to lead to a problem with another. So if we talk about restrictive disease and these people are going to wind up with a smaller lung, okay, the amount of air moving in and out with each breath is going to be less, but it's going to be at lower lung volumes, okay? For the obstructive disease patient, the amount of air moving out with each breath is also going to be less, but that's going to be at higher lung volume. So the person with obstructive disease is going to be breathing less out here, whereas this person with restrictive disease is going to be breathing less over here. Does that make sense? Any questions about that so far? All right, so another thing, when I worked at NYU, we had a delineation between the cardiovascular and the pulmonary rehab program, and the cardiac patients didn't really want to work in the same gym as the pulmonary patients, and the pulmonary patients didn't really want to work in the same gym as the cardiac patients. And I see a little bit of, you know, this same type of sort of, I'm not going to say discrimination, but this sort of like, that's not me, between the obstructive diseases and the restrictive diseases. And that is, I could see that that could be an issue, okay, if there really was a difference in how we get people to be less short of breath. But I'm going to tell you that we train people, we train a lot of people with restrictive disease, we train a lot of people with obstructive disease, and there's a very simple, no, I take that back, it's not a simple formula, okay, but the way that we get people to be less short of breath is by conditioning. Okay, so one of the other things that we're going to talk about tonight is what is an actual treatment versus what is an exercise versus what is an actual tool that is going to just help us get from point A to point B. Because when we talk about breathing techniques especially, you know, people talk about pursed lip breathing. So I'm not going to give you new rocket science tonight that's not going to involve pursed lip breathing or diaphragmatic breathing or paced breathing. But what I'm going to try to get you to do is to understand the whole continuum from I feel fine to now I'm a little short of breath to now I'm more short of breath to oh, I'm really short of breath and I'm about to have a big problem here. Because understanding how we get to point A to point B is the only way, okay, that you're going to be able to put a stop to this, okay, and have some greater control over your breathing. So again, we talk about shortness of breath. There are a few things that are as scary as not being able to catch your breath. Everybody here has been there, okay? You know, if you don't think you can catch your breath, you're going to stop doing all the things that make you short of breath. So again, most people start to get short of breath at high levels of exertion. Stair climbing, walking uphill, walking fast, running for a bus, carrying, bending over, okay? Washing their hair, taking a shower. And there's similarities between all these different things, but the principles in how do you get out of trouble, and not just how do you get out of trouble, but I want to teach you how to prevent yourself from getting into trouble. And we're going to have to talk about other components, things like anxiety and things of that nature. I talked about the fact that shortness of breath is multifactorial. So a lot of times people will go to their doctor and they'll say, I am short of breath, or I am more short of breath, okay? My shortness of breath is getting worse. And the doctor does some testing, listens to your lungs, says your lungs sound okay, does a pulmonary function test, says there's been no change in your pulmonary function, okay? So if pulmonary function remains the same, how is it that we're more short of breath? And here's another, you know, scenario that we see, which is that people go through rehab, okay? if you look at the classic literature from the past 30 years about pulmonary rehab, what people say is that people feel better, they're less short of breath, they can do more, okay, and they're in a better mood, or they feel more emotionally healthy. However, there is no way to improve pulmonary function, okay? So again, people feel better, they're less short of breath, they can do more, but their pulmonary function has not improved. So I'm going to say, first of all, that I don't believe that that's actually true, because we have many cases of improved pulmonary function, and the reason for that, in my opinion, is because of the type of training that we do, which is different than the type of training that 99.9% of other programs do, and I will talk about that a little bit, okay? We recently got back from a national conference where that was the theme. The theme was, you can feel better, you can be less short of breath, we cannot improve your pulmonary function. So my question is, if for 25 years we've been doing one type of training and it doesn't show that it improves pulmonary function, well, maybe we should try something different. And that's what we do here. We'll talk about that and some of these techniques that will actually, in my opinion, not improve pulmonary function. I'm not going to say it's going to improve pulmonary function. I'm going to say if you have the ability and your body has the ability to improve its pulmonary function, this will give you the greatest opportunity to do that. So back to shortness of breath. Shortness of breath comes on at high levels of activity. So just from the people right here, if you had to name one activity that causes you the most shortness of breath, and I'll also include that causes you the most anxiety related to your shortness of breath, what would that be?
Stair climbing.
Stair climbing.
Just raising my hands.
Raising my hands, okay? This is a very important thing, okay? So raising your hands includes a lot of different things, okay? Now, let me just go back because I don't want Tony to feel left out. But if we talk about stair climbing in New York City, okay, if you live in a walk-up, you're in a jam, okay? And there's a lot of people that are in these rent-controlled walk-ups for 25 years and they don't want to move out. But now, all of a sudden, walking up 5 flights is a daunting experience. Or if you go to work and your way of getting to work is the subway, okay, and now you can't walk those subway stairs, or you're so terrified that you're going to get short of breath and not be able to catch your breath, this puts a crimp in every single thing that you do, okay? Now, overhead activity, and this is something that I'm going to talk about at the back again, but if you have difficulty with overhead activity, and there is a legitimate physiologic and mechanical reason why this activity is difficult for people with lung disease, and I'm going to tell it to you later, okay? But just imagine this, if this is a problem for you, think about the things that you cannot do, okay? I can't bring things down from the shelf, okay? I can't wash my hair. For some people, shaving is a problem. For some people, brushing their hair is a problem. So the point is that with each thing that you have to eliminate, okay, we wind up in a situation where it becomes less and less and less and less. Let me hear one more thing that causes people shortness of breath.
Just like lying in bed at night, trying to fall back to sleep when I'm awake in the middle of the night, and might be partly because I put my arms like this and I lie on my stomach. I don't know.
Okay, so so here's the thing. We're going to talk about supply and demand, right? So it's very clear that walking upstairs is a big demand, right? Which means you better supply a lot of oxygen for this. Okay, this overhead activity, once I tell you why that's problematic, is going to make sense to you. But lying in bed at night, okay, think about that, okay? That doesn't seem like it would require a big demand of activity, right? So something else has to be going on there, okay? And I would think that it probably has to do with mechanics and or position, and we'll talk about that a little bit as we go along. So back to shortness of breath, the typical scenario is that people start to get short of breath at high levels of activity. So let's say stair climbing, okay? Let's say I go to work on Wall Street, okay, and I'm going up and down the subway stairs twice a day. So that's 10 flights of stairs a week, and that's 500 flights of stairs per year. That means that if I all of a sudden stop doing that because I can't take the subway, and now I take the bus, all of the muscles that you use to climb stairs get weaker. And when those muscles get weaker, they don't use oxygen as well. And when they don't use oxygen as well, guess what? You now start to get short of breath at lower levels of activity. Okay? So when we talk about how the body uses oxygen, there are three main things. There are a lot of things, okay, but there are three main things that is dependent upon. So number one, how good are your lungs at moving air in and out? Okay, so we're going to say the respiratory system. Number two, how good is your heart at pumping blood? And number three, how good are your muscles at using the oxygen that is delivered to you? Okay, so we're talking about miles per gallon. So if you think about a car, okay, excuse me, everyone, can you just shut that door, please? Thank you. So if we're talking about a car, okay, and we want to talk about miles per gallon, that's what we're talking about when we talk about how good is your body at using oxygen. So think of it like this. If you don't have the right amount of air in the tires, or your spark plugs have not been changed in 3 years, or you have an oil filter that's filthy, okay, each one of those things is going to contribute to the car being less efficient, okay? Same thing here. So if you have a problem moving air in and out, then that is going to decrease the overall efficiency of how your body uses oxygen. If you have a heart problem, okay, and people talk about the cardiovascular system and the respiratory system or the pulmonary system, to me, I'm a purist. I think it's one system, okay? I'll make that case till the end. It's the cardiopulmonary system. Not only are they so close together, they're so intimately involved that it's one system. So I know there are some people who have heart disease that don't have lung disease, and there are some people that have lung disease that don't have heart disease, but they are very well connected, okay? There's a lot of similarities, and a lot of the training that we do involves both, okay? But if you have a heart problem now, and that could be coronary artery disease, that could be congestive heart failure, that could be atherosclerosis, that could be arrhythmia like atrial fibrillation, that is now going to also limit your ability to use oxygen, okay? And now let's go to the muscles. So you know that your muscles, okay, are going to, as they exercise or as they do activity, waste products are built up. The muscles pump, that brings the waste products away, and that brings the good, healthy oxygen to it so that they get nutrition, okay? So if those muscles are deconditioned, then you're going to be less efficient at using oxygen. So these are the three main things. Not that there aren't other things, the endocrine system is involved, the neurologic system is involved, but when we talk specifically about how do we make you better at using oxygen, we have to talk about the ability to move air in and out, the ability of your heart to pump blood, and the ability of your muscles to utilize oxygen better. And there's good news here, and the good news is that there's one thing that impacts all of them, okay? And that is exercise, okay? So exercise is going to improve your body's ability to move air in and out, and I know that there are skeptics out there who are going to say, no, that's not true, it doesn't improve your lung function, it doesn't improve the ability to move air in and out, but wait, because soon we're going to publish our data that shows that we know that if you do the right exercise, okay, and I say the right exercise, okay, you can possibly improve lung function. Okay, and I say possibly, and I say if we get 50% of people that improve lung function, well, that's a big step up from starting the conversation with you cannot improve lung function, because you cannot improve lung function means that your disease cannot get better. Okay, so keep that in mind. So again, exercise is going to improve your ability to move air in and out and be more efficient with your respiratory system. It will improve your ability to pump blood of your heart, and it will also improve how your muscles use oxygen, making the whole machine more efficient. Any questions so far? Okay, so shortness of breath. Okay, back to that. So I'm going to say it one more time. You have trouble walking upstairs. You now have eliminated stairs. Now you take the bus. Okay? However, you know that now you're aware of all the hills in the city, right? And I apologize, we have people here from 43 states, so I'm going to talk about New York City, it's my home, but this applies to the people down south, the people out west. You know, it applies to everybody, okay? I'm trying to teach you concepts that you will be able to apply to your everyday life. So here's the thing. So now, it's not just that I can't walk upstairs, but walking uphill is a problem for me, okay? And to get to the bus, I have to walk 4 blocks up a hill. Does this sound familiar to anybody? So guess what? I know people who can map out this city, okay, by where the hills are. I know other people who can map it out by where are the bathrooms, okay? I know other people who can map it out by where is there a place to sit down. And these are things that all of a sudden you have to think about just to go about your everyday life. I want to walk to the corner and get a paper, and I got to think, is it uphill? Is it downhill? Is the New York Times going to be double today, so I'm going to have to carry more? Do I have to pick up something else along the way? Is it cold, meaning it's going to lock up my airways as soon as I get out? Did I take my medication? This is what I mean when I say that breathing is multifactorial, and people don't tell you these things, okay? So if you don't understand the way these things work, you're in a situation where you are just floating on the top of the ocean, waiting for every fish in the sea or shark in the ocean to come and take a piece of you because you don't know how to defend yourself. So what I'm trying to do is I'm trying to teach you about all of the different things that you have to know about, okay? And I'm not trying to make you a scholar in lung disease or make you go home and study, okay, there's an uphill to Fifth Avenue, but by having some basic understanding of these things and how your lungs work and what makes them better and what makes them worse is going to go a long way, okay? Classic saying, if you teach a man to fish, okay, he can eat for life. If you give a man a fish, he eats for a meal. So we're trying to teach you to fish so that you don't need us anymore, so that you can, be able to problem solve these situations yourself and say, well, I have to go to the opera tonight, and I know there's a lot of stairs there, so in preparation for that, I'm going to make sure I've taken all my bronchodilators and I have my oxygen fully charged, and I'm going to do the breathing techniques as I go up the stairs. So these are the kind of things that you need to think about, except that you know damn well that when that hits the fan and you're out and all of a sudden your chest locks up and you're going, that is not when your best thinking is going to be done. Okay, that is when panic sets in. And that panic sets off a whole bunch of other responses that, guess what? Makes your heart beat faster, but not more efficiently, faster. Okay, it makes you breathe faster, not more efficiently, faster. Right? So think about this. Now my lungs are getting tighter. I'm having more trouble breathing. Now I'm thinking, oh no, what's going to happen? My body's throwing adrenaline out, and that's making me, and it's all cyclical. Okay? All these things are cyclical. So my goal and my job and my desire is to teach you how to break into these cycles. But to break into these cycles, you have to understand what is happening. Okay? The best way to know what is different is to kind of track what's the same. So in other words, if you go to your doctor and you say I'm more short of breath, the first thing that needs to be known is, well, what's different, okay? So if nothing is the same, but it's now 85 degrees and humid as compared to 3 months ago when it was 60 degrees and dry, well, we could say it's the weather, okay? Or if you've put on 5 pounds and that weight is sitting right here, and now you have to work that much harder to elevate the rib cage, okay? Well, we can say, well, you've put on, 5 or 10 or 15 pounds, and that could be the cause. But what I don't like, and what is not really beneficial for people, is when people talk in generalities, okay? And when we say, well, it could be this, or it could be that. Now, I recognize completely that there are times when there's not a very clean answer. You can't point to something and say, well, this is why you're having a problem now. But it's really important to take, solid history, to really talk to your patient and understand, well, what are all the things that are the same? What are all the things that are different? And then if the problem is that you've gained 15 pounds because all of a sudden you've developed, a Quiznos pizza addiction, then let's not try to treat it with a bronchodilator that isn't going to do anything about the weight. So my point is really, let's figure out what's really happening. Let's address the issues, but let's address the issues that are not just respiratory related, because as I told you already, and as I tell you every week, if you feel worse but your pulmonary function is the same, guess what? It is not your respiratory system. Okay? There's something else. And those are the things that we need to find out. And these are the things that we're going to talk about when we talk about shortness of breath. So last point about shortness of breath before I move on, but we talk about shortness of breath all the time. So walking upstairs, eliminate the stairs. All the muscles you use to walk upstairs now get weaker. They're less efficient. They don't use oxygen as well. You become more short of breath at lower levels of activity, okay? That's what happens, okay? Now we're afraid to walk uphill. So now we only walk on flat surfaces, or if we have to go someplace where we have to walk uphill, we take a taxi. So guess what? Those muscles get weaker again, okay? And they become less efficient. So now maybe you're short of breath even walking on flat surfaces. And this is how it works, okay? And it's not always predictable, okay? And sometimes you could feel like you've gotten much worse, because guess what? Up here is stair climbing, right? Up here is walking uphill. Oh, I'm sorry, stair climbing, walking uphill. And remind me, I'm going to talk about stair climbing later, because this weekend my team is going to walk up 55 flights for the American Lung Association. But now we get in trouble walking uphill. Now we get in trouble walking on flat surfaces, and now we don't leave our house, okay? But understand here that at this point, okay, at this metabolic level, because let me tell you, what we're talking about is metabolism. We're talking about the scientific chemistry of how does your body use oxygen. But maybe at this point, it's not just walking flat, but it's getting dressed, okay? It's walking the dog. It's doing the laundry. So there's going to come a certain point at which many things may wind up being eliminated at once. So when you just eliminate stair climbing, you say, well, I'm not going to take the stairs anymore. But when it becomes, well, now I can't cook dinner, and now I can't do the dishes, and now I can't vacuum, and now I can't get dressed, and now showering is difficult, that's a big problem for you, and that affects many areas of your life. Now here's the good news, okay? It's not your respiratory system, meaning that your lungs haven't gotten worse. Then we can figure out what is it, hopefully, and in the same way that you spiral downhill, we can start spiraling you uphill again, okay? And how do we do that? Our goal is to break into the cycle of shortness of breath and inactivity by, number one, teaching you more effective breathing techniques, which we will talk about tonight, and then exercising you so that your body gets better at using oxygen, okay? And in the same way that you spiral down, you start to spiral back up. Any questions so far? All right, so let's talk a little bit about normal breathing, okay? So the purpose of breathing is to bring healthy air, oxygen, for fuel into the body and eliminate waste products. So the main waste product of respiration or metabolism is going to be carbon dioxide. So we're going to bring oxygen in, at its simplest term, blow off carbon dioxide. So air can enter the body from 2 points. It can enter through the nose, it can enter through the mouth. So breathing in through your nose is actually beneficial, and it serves 3 main purposes. The first thing is that it filters the air. So you have hairs in your nose. I don't know if it filter the hair, but I meant filter the air, okay? You have hairs in your nose that actually will catch dust, catch particles, catch things that are going to be harmful to you. It's going to warm the air, and it's going to humidify the air. So the body likes to use air that is the most like it. So it wants air that's about 98.6 degrees, nice and moist, nice and clean. So this explains why when you go outside and it's 101 degrees, and it's dusty because there's a sandstorm or something like that, well, that's not consistent with what the body likes. On the converse side, if you go outside and 50 degrees outside, or worse, 20 degrees outside, we're getting killed here in New York this winter. It's a terrible winter for us. So now we're 65 degrees air, 65 degrees lower than what the body likes to use. Well, guess what? That means the body has to work that much harder to get that air ready to use. So breathing in through the nose, okay, warms the air, humidifies the air, filters the air. The other thing is that you can breathe in through your mouth. So you can take a greater volume of air through your mouth. So I'm going to give you different alternatives for breathing techniques. So there are some basics, okay, but it's not all or nothing. And like I say many times, not all things will work for all people, and not all things will work all the time. So once we're out of in for 2, out for 4, if that doesn't work for you, it shouldn't be like, well, it doesn't work for me, or I have restrictive disease, and so therefore in for 2, out for 4, that's for people with COPD, that's not going to work for me. But understand that we have to have a starting point someplace, okay? So my program, we opened in 1998. In that time, we've done over 60,000 visits with patients, which is more than anybody else in the country, okay? And we've gotten to see a lot of people across the whole spectrum. People of all ages, people of all races, people of all sizes, people of all degrees of lung problems or heart problems or musculoskeletal problems. And if all we did was say, oh, well, 2 and 4 isn't working for you, then you're out of luck, we wouldn't be very successful. And so we really want to help you problem solve, but you have to have a starting point. And I'll tell you that in for 2, out for 4 works for most people. So if it doesn't work for you, what I'm going to try to teach you tonight is how to find something that does work for you. Air enters through the nose or the mouth, okay? So when it goes back in the nose, it goes through the nasopharynx, it's called, and it goes to the oropharynx. When it goes in through the mouth, it meets back here in the pharynx, which is another name for your throat. It comes down here past the larynx and into this tube right here, which is the trachea. The trachea is also known as the windpipe, okay? And it's the biggest airway you have. And then it splits, okay? This point over here, if you put your hands, if you slide it down from the top of your, just below your neck to here, you're gonna feel a ridge. This is the point where it splits into right and left main stem bronchus, okay? So this splits, and this will go to the right lung, this will go to the left lung, and then we continue to branch. So we have a right, upper, middle, and lower lobe. We have a left upper lobe and a left lower lobe, and there's something in the middle that's called the lingula, which some people think of as the middle lobe, but some people will say the left has just an upper and a lower. And then it continues to branch from trachea to bronchi, and then these keep continuing to branch to what's called bronchioles, which are smaller bronchi, and then they end in the alveoli, and the alveoli are the air sacs where gas exchange actually occurs, okay? So one more time, I know that was quick, but air enters through the nose or the mouth, nasopharynx, oropharynx meet in the throat at the pharynx, come down past the larynx into the trachea, which is the windpipe, splits into the right and left main stem bronchus. The right lobe goes, the right lung is then split upper, lower, middle, left, upper, lower, okay? And then this continues to branch from the bronchi to the bronchioles to the alveoli, and that is where gas exchange occurs. Oxygen goes into the blood, carbon dioxide comes out of the blood, and it goes out that whole system, and it's blown off. Any questions so far? Yes, ma'am?
I'm trying not to preface this by saying this is a stupid question, but when you say into and out 4, you mean in 2 through your nose and out 4 through your mouth?
Nope, we're going to get to that. I mean, yes, but I will get to that at the end. Okay? Not at the end, but as we move along, that's exactly what we're going to talk about. Okay? So again, there's a couple of things to point out at this point. You can have a problem anywhere along that route. So now we go back to efficiency, right? So if everything is working right, beautiful. Air comes in with good oxygen, air goes out, blowing off the carbon dioxide. But let's think about this. So now somebody says, well, you have COPD. So now you think, oh, all my respiratory problems are related to my lungs, right? But that's not really so. How many people have a stuffy nose right now? I do, okay? It's winter in New York City. So the heat is hot, it's dry, it stuffs your nose, okay? How many people have a sore throat, okay? How many people can have what's called tracheobronchitis, okay? Bronchitis, chronic bronchitis. Itis, and itis is a universal term, it means inflammation. So you can have inflammation anywhere along this system, and that's going to cause a problem for you. You can have sinusitis, okay, and that can make it more difficult for you to breathe. You could have a deviated septum, okay? You could have laryngitis. Any of these things or a problem anywhere along this system is going to lead to a decreased efficiency in your ability to move air in and out, and therefore the ability to increase the supply. Now we talked about supply and demand, right? If you're walking and the temperature is nice and cool and you're only walking for 15 minutes, you probably don't need that much water to drink, okay? But if it's 98 degrees outside and you just walked a mile outside and you're sweating profusely, you're going to need much more water. Same thing with oxygen supply, and same thing with shortness of breath. So sitting in the chair, okay, and you have to think about these things from the perspective of what is the demand of this activity. So we think of it as metabolic equivalence, and that's a kind of a too scientific conversation for this talk tonight, but we can give a metabolic equivalent to all different activities. So stair climbing has a very high metabolic equivalent. Sitting in a chair has a relatively low metabolic equivalent. Lying in your bed has a low metabolic equivalent. So for the majority of people, when they come in and they say, I'm short of breath, and I say, when did your shortness of breath begin? They say, well, it began about a year ago, now it's getting worse and worse, started at high level of activity. Now I get short of breath just running for the phone, okay? Because what happens? Phone rings. Oh, the phone is going to ring. I hope I don't get short of breath. Let me run and get it because I've been waiting for this call all day and it's my doctor, and I get to the phone and the person on the other end says, are you there? Because you're too short of breath to say hello, right? You're going, and you say, give me a minute, I have to catch my breath. This is something that people experience a lot, okay? So the key is look at the supply and demand of the activity. So sitting and doing nothing. If you're short of breath sitting and doing nothing, that's a problem, okay? If you're short of breath going up subway stairs, a lot of people are short of breath going up subway stairs who don't have a lung disease, just by nature of their conditioning level, okay? Or the fact that they're overweight, or the fact that they never take the stairs, or the fact that they're anxious that they're going to get mugged or something like that. All these things play a role in how you breathe. And like I said, a problem anywhere along the line, not just with the lungs itself, can cause shortness of breath.
So do you stop when you're going up the stairs?
So the question is, do you stop when you're going up the stairs? Excellent question. So this is a great place to start, and the start part is, let's start worst to best. Okay, so let's start, what do we fear most? We fear that we're going to get in a situation. I'm going to tell you what thousands of people have told me over the past 22 years. I'm afraid it's like the relationship issue. It's like I'm afraid to open up because I don't want to get hurt. It's like I'm afraid to do these activities because I don't know if I am going to be able to catch my breath. I am not going in the pool because I don't know how to swim, and I don't know if I'm going to be able to get back to this shallow part of the pool. I'm not going in the ocean because I don't know if I'll be able to get back to shore. So if I don't know if I'm going to drown or not because I can't swim, I'm not going in the pool. If I don't know if I can walk to the grocery store without getting so short of breath, I mean, and what's the worst fear that goes through your mind? You think about it, I can't catch my breath. Then you think, oh my God, maybe I'm going to have a heart attack. Oh my God, maybe I'm going to keel over. Oh, there's the lights and sirens, what am I going to do? Okay, and it's terrifying, okay? It could sound funny. It's not funny at all, okay? Because this is sometimes realistic, but more often than not, your mind is playing tricks on you, okay? It's this thing that increases your anxiety increases your shortness of breath, your shortness of breath gives you more anxiety until it really is like this crazy snowball where you don't even know what's happening anymore, and you just need somebody to pull yourself out, to pull you out of it, okay? To smack you in the face and go, hey, pull yourself together. And what I want to teach you tonight is how do you become that person for yourself, okay? You want me to do it for you? Come to the Pulmonary Center, I'll smack you in the face, I'll snap you out of it, but I want to teach you how do you get yourself out of a jam. So let's think about that. How many people are afraid of what I just told you? Okay, so you don't start at the Olympic level, right? We start at junior varsity. So anything I'm going to tell you tonight, we're going to start at a low level. So if you're afraid of walking up subway stairs, the first time I meet you, I'm not going to say, all right, let's go train on the subway stairs. We're going to start you low level. Once you're confident with that, then we build up the level, then we build up the level, then we build up the level. But you must talk to yourself. So in the same way I say, I'm going to say, stop, you know what to do here. After tonight, you're going to know what to do in those situations, and you have to talk to yourself. You have to say, Tony, stop, you know what to do here. Gloria, stop, you know what to do here. Dorothy, stop, you know what to do here. And then think of my face. No, I'm just kidding. That's going to make you more nervous. That's going to make you more nervous. Don't do that. But what?
You don't avoid it.
It's scary.
What?
You do not avoid these things.
I'm going to talk you through it right now. I'm going to tell you exactly what to do. Okay? So let's talk about the breathing techniques. Okay? So the first thing you do is you say, stop. I know what to do here. Okay? And let me tell you one of the beauties of pulmonary rehabilitation. I am 500% biased. I love pulmonary rehabilitation. It's what I do day in, day out. It's what I make my living off of. It's what I feel I've been gifted to be able to do for my life every day, is to help people breathe. Very often people come here and we have a situation where we test them and they are short of breath and they're going, oh my God, my heart is beating so fast, my heart is racing, and my blood pressure must be sky high, and my oxygen must be in the 70s. And then I say, hold on, would it surprise you to know that your heart rate is only 95? And you are 85. So guess what? You can actually go 50 more points and still be okay. Or would it surprise you to know that your blood pressure is 160 over 80? And people go, 160 over 80? That's terrible. And we say, no, no, no. That's where we want you. Now, if you were sitting and doing nothing and your blood pressure was 160 over 80, that's a problem. But let me give you some numbers, okay? When we exercise people here, we will allow you to go to a heart rate. Now, I'm not telling you what you should do, okay? I'm strictly speaking about my own practice. Please understand that everything I talk about, I'm not giving you medical advice, I'm not giving you rehab advice, I'm talking about what we do with our patients. And anything that I would recommend you do, you must discuss with your doctor. And you could say, some guy in New York told me this, I'm willing to have a conversation with you about that. But it's really important to understand that everything we do here is done under fully monitored conditions. So when every single one of our patients exercises, we have them hooked up to an EKG the whole time. Now, I know a lot of programs don't use EKGs, okay? To me, I feel that's a mistake. And one of the things we do is we consult with other programs about how they run their rehab centers. And once we switch them from not using an EKG to using an EKG, it's like the Wizard of Oz, and now all of a sudden we're in color, okay? Because all of a sudden you're seeing things that if I don't have that EKG, I have to stop you. Because if you say, I feel tightness in my chest, as is a heart condition, but is also a respiratory condition, right? We see people with lung disease all the time who say, there's pressure here, okay? But if I don't see something that's indicating to me, is your heart okay? I have to assume the worst and I have to sit you down. So we look at your EKG so that we can see your heart rate and rhythm. We're checking your blood pressure every 5 minutes, and we're checking your oxygen every 5 minutes to make sure you're okay. Okay, now if I came to your home, and a lot of times people say, well, I want it in my house, okay? Besides the fact that I tell them that my prices to come to your house are obscene, okay, I also tell them that even if I come to your house, I have to cut you back by at least 50% from what I can do here, because I don't know what's going on. And I don't like to get caught taking a risk that has no basis in science. Everything we do is scientific, okay? And a lot of times when you have heart disease, when you have lung disease, when you have things like pulmonary hypertension, pulmonary fibrosis, COPD, often patients look worse than they actually are because shortness of breath looks terrifying, okay? So it's like, it's not just the shortness of breath, you're looking at the big picture here and you're saying, this patient looks bad, and that's scary for a lot of people. That's scary for a lot of professionals even, okay? So if someone comes in and they're going, the last thing somebody's gonna do is want to put them up on a treadmill, okay? But if I can look at your EKG and say, well, your heart rhythm and heart rate and rhythm is fine, your blood pressure is fine, your oxygen is fine, well, that's valuable information for us, because now we can say, well, is this kind of how you feel when you're in the street? Say, yeah. So talk to yourself and say, you know what, I'm probably okay. A lot of times people say, you know, my heart is racing, and I say, no, it's not racing. I see what your heart is doing. It's only 85. So what does that mean? That means there's other sensations going on. And it's this anxiety that once that kicks in, you have nothing to do but to stop, okay? So let's talk about that. So now let's imagine the situation. You're out with your friend's a really fast walker, and you don't want to admit that you're having trouble breathing, right? So you're gonna walk fast, you're trying to do some breathing techniques, but eventually you go, and your friend goes, oh, wait, are you okay? And by the time that friend turns and notices that you're not okay, now you're locked up, okay? So I want to stop you before you get to that point, okay? And so that means becoming aware of what is the energy requirements of the activity. And I'm not talking about, you know, 4 Kelvin, you know, I'm talking about basics here, okay? And I'm going to show you 3 things. I'm going to show you a couple of ways to try to figure out, are you okay or are you not okay? But let's say this, you're about to get into a jam, okay? The first thing, what are you going to do to you? What are you going to do? I'm feeling short of breath. I'm getting to the point where I'm like, oh, I'm starting to get short of breath. I'm thinking about it. My body is starting to put out adrenaline, right? Which is making my heart beat faster, which is making me more short of breath. And now it's just escalating, right? Now we have this snowball situation. What's the first thing I want you to do? Talk to yourself, okay? Say, stop. I know what to do here. Okay? A car is, you know, let's say your car, you're driving, right? Has anyone ever had the experience where you're on a trip, your gas is almost at E, and you're not sure if you're going to make it to the end of the trip, okay? So you're never going to become more efficient or get more gas by driving faster, okay? You have to break into that cycle at some point. So first of all, say stop. I know what to do here. Talk to yourself. And it sounds stupid, but I have situations like this too, where sometimes, you know, I'm underwater and I'm starting to get short of breath or I'm getting anxious, and I have to say to myself, stop. What are you doing? Wait, you know what to do here, and then I do it. Okay, that's what I want you to do. You don't have to see my face, but when you start to get into a jam, or before you get into a jam, say stop and you know what to do here, because in a few minutes you're going to know what to do here. But I'm going to take it from the worst, and then we're going to work our way up from bottom up, and we'll meet in the middle. Okay? So stop, I know what to do here. I need to decrease the demand, right? Because walking uphill, that has a high demand. I have a respiratory condition, and it doesn't matter now if it's obstructive or restrictive, or if it's pulmonary hypertension, or if it's something else that's causing me a lot of mucus. My ability to supply, okay, is limited. So if 2 people show up for dinner, I can handle it. If 50 people show up, I don't have the tools to handle that. And it's the same thing. So walking on a flat surface may be okay for me, I can handle that. Walking uphill, walking fast while carrying 2 packages, well, that may be the tipping point at which you can no longer handle that. So you have to stop, immediately decrease the demand. How do you decrease the demand? Stop what you're doing, because now you can work on increasing the supply. But if the demand is going up, 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 and the supply is trying to chase it, you're not going to catch up. I can tell you that right now. So first order of business, stop what you're doing. Okay? And now let's get into the breathing, and then you're going to do the breathing technique. So I'm going to teach you, this is what I'm going to teach you. Stop what you're doing, use recovery from shortness of breath techniques, and then use controlled breathing techniques, and that's what we're going to talk about now. Any questions so far before we go into this? So again, remember what I said, okay? Not all things work for all people. So if what I tell you right now on the base level doesn't work for you, I'm going to give you some alternatives to that. And don't try it when you're walking up the subway stairs carrying 2 packages at rush hour. Okay? Try these things out. Figure out what works for you. Some will work better. Some will not work. You may know things that I don't know. Okay? I've been doing this 22 years, and the overwhelming majority of what I know, I've learned from my patients. Patients come to me. We watch them. They tell us things. They say, this has been helpful to me. Okay? So you may know things that I don't know, and if there's something that you know that I don't know that can help my patients, by all means, send me an email. I'll send you some money because I would love to use it. Okay? That is a very effective thing, but most things we learn from patients. And now, again, I'm about to be in trouble. I'm out in the street, it's cold, my chest locks up, now I'm short of breath, now I'm getting more anxious, I'm breathing more quickly. So think about it like this. I want to tell you one other thing before we move on. The trachea is right here. That's your windpipe. None of the air in the trachea can get into the blood where your body can use it. None of the air in the trachea can get into your blood where your body could use it. Okay? So that means in order to get even the first drop of air and the first molecule of oxygen into your lung, you have to breathe in more than the trachea. So if you're breathing very fast and very shallow, which is the most common thing that people are going to see, when you get into a jam, you go, right? So imagine what's happening here. You're going, air's going up, and your oxygen is going boom, down, because no air is actually getting into your lungs. Okay? And that oxygen going down can now trigger a whole bunch of other things related to your neurologic system, your cardiovascular system. So that's something to keep in mind also. So you probably noticed that when you get in a jam, you're breathing fast and shallow. So the first order of business, think about it like this. We want a deeper, slower breath. Okay? So stop. I know what to do here. If you're really already past the point where you're in trouble, you're going to do a recovery from shortness of breath technique. Okay? If you are still pretty good and you feel like you just need to settle down a little bit, you're going to do a controlled breathing technique. They're very related, but I'm going to tell you the differences between them. Here's the breathing techniques. Okay? The diaphragm is a dome-shaped muscle that sits down here in the abdominal cavity. Okay? It sits under the stomach, under the lungs. It is the main muscle of inspiration. It's a very inspirational muscle. It does not matter if you have restrictive disease or obstructive disease, the diaphragm is the primary muscle of inspiration. Okay? And the way that this works is the diaphragm contracts downward, and that creates a negative pressure that inflates the lungs. Okay? When you have difficulty breathing and the diaphragm is not as effective, and that can happen sometimes, particularly more so with obstructive diseases than restrictive diseases, but when you have an obstructive disease and your lungs get bigger and what we call hyperinflated, that flattens out the diaphragm. And when the diaphragm gets flattened out, it's not at a good mechanical advantage. So it can make it more difficult for you to use your diaphragm. And as a result, you try to use other muscles called accessory muscles. Okay? Accessory muscles can be muscles in your neck, muscles in your shoulders, muscles in your chest, muscles in your back. Okay? But they're not the most efficient. They're secondary muscles. So the first breathing technique that I want to talk to you about is called diaphragmatic breathing. Okay? Since it's the strongest muscle, okay, we want to support that muscle as best we can. And the way that we do that is by understanding how it works. So when you are taking an effective breath with your diaphragm, okay, as you breathe in, this area over here should rise and come out. So the breathing technique that I'm going to have you do, I'm going to have you breathe in through your nose, and I'm going to have you blow out through your mouth. So we're going to do two different techniques. One is called diaphragmatic breathing. One is called pursed lip breathing, which people know about. And then we're going to put them together for what's called paced breathing. And it's all going to be coordinated. So let's just start by the idea of breathing in through your nose. Okay? First, let's take a breath in through your nose and blow it out as however you want. Okay? I don't care how you do it, but for now I just want you to feel the sensation of what is it like to breathe in through your nose. So let's just take a breath in through your nose. Okay, so as I mentioned before, if you have sinus trouble, if you have a deviated septum, if you have a stuffy nose, if you're congested, all these things can negatively impact your ability to take a breath in through your nose. Right? And that needs to be addressed. So you could be more short of breath with your respiratory system still intact, without your lungs getting worse. Now we're going to do what's called pursed lip breathing. And I'm going through this just to give you the whole picture, and then we're going to go through it more slowly. And I'm going to tell you why we do each one and what they do. So now we're going to breathe in through your nose, and instead of just any way you want, we're going to do what's called pursed lip breathing. And when you do pursed lip breathing, we're not going to go, and we're not going to go, and we're just going to create a little slit, and we're going to let that air come out nice and slow. Okay? Now, for you people with pulmonary fibrosis and interstitial lung disease and restrictive diseases, bear with me. This is not just for COPD, it's the starting point. And I'm going to talk to you more about things that might be more beneficial for you if this doesn't work. But this does work for a lot of people, even with restrictive diseases and with obstructive diseases. So now what we're going to breathe in through your nose, out gently through pursed lips. So you're going to go. Now, I have heard people say, smell the flowers, blow out the candles. Has anyone heard this before? Smell the flowers, blow out the candles. Smell the flowers is good. Let me tell you why blow out the candles is not good. Smell the flowers is this. Blow out the candles is this. Right? Think about your pulmonary function test. Okay? How we find out if people have obstructive disease or restrictive disease is through a pulmonary function test. And if you think about the test, the first thing they ask you to do, breathe in, let it out slow. Right? And then breathe in and blow out as hard and as fast as you can, which is like blowing out the candles. And the reason why blowing out hard and fast is an important maneuver in a pulmonary function test is because for people with obstructive lung disease, that is exactly the maneuver that elicits that obstruction. So the harder you blow, the more air trapping you can get, the more airway narrowing you could get, the more bronchospasm you could get. And so if we think about an airway like this, okay? Think of it like a street. We want this to be as open as possible. We want air, we want it to be wide, we want air to move in nicely, we want air to move out nicely, okay? So if this causes this, And now guess what? We just narrowed our street significantly. We don't want you blowing out hard. It's counterintuitive, okay, because it feels like the harder you work, the more benefit you're going to get from it, okay? But think about this, when you're out in the street and you're in a jam, you want to go, but you have to in fact do something different. So for now, what I try to tell people is breathe in through your nose, out through your mouth, but when you blow out, instead of trying to blow out the candles, imagine you're just trying to cool some soup. Because if I were trying to cool some soup, Gloria's sitting right there, I don't want to go, I'm going to get soup all over Gloria, okay? So nice and easy, in through your nose, out gently through your mouth, okay? The other thing, and again, we're going to talk about obstructive, restrictive. This applies to everybody, but I'm going to give you some techniques first. Bear with me as we start with in for 2, out for 4, okay? And it's true that this technique came from watching people with COPD breathe, okay? And we know that people with COPD have no problem bringing air in, but they need a longer time to blow air out. Okay, because of air trapping, because of narrowing, because the lungs, recoil is not as great, so they need a little bit more time. Now, for some people with restrictive disease, depending upon how severe is your disease, what stage are you, what is your overall level of conditioning, this may work just fine. But let's start with in for 2, out for 4. So you're going to breathe in through your nose for a count of 2. You're going to blow out through your mouth or let air out through your mouth through a count of 4, and it looks like this. So you're going to breathe in, and blow, 2, 3, 4. So here it goes. So and then you start to cycle over again. So now think about this, okay? If this gives you greater control over your breathing, even if it doesn't increase the supply, which I would make a case that it could potentially increase the supply, at least it minimizes lowering the supply, right? So we want to increase the supply as much as possible in order to meet the demand. So let's say with exercise, I want you to try to do as much as possible. Okay? I want you to live your life. And I don't want people to come here and rehab, you don't live your life so you could come and rehab. You rehab so you could live your life. So we want to try to teach you these techniques, but I want you to try to maintain as many activities as possible as long as you can meet the supply. Now, it may not mean that you walk up the hill the same way you did 6 months ago. Maybe you can modify it in a way. And these are all the things that, by doing it this way, you can just ask yourself, what am I doing here? Do I have an increased supply? I know I'm walking up a hill, so I have an increased demand. Therefore, I'm going to try to increase the supply. If my lungs don't allow me to increase the supply, then I have to figure out a way to decrease the demand, right? So let's say I'm walking uphill, as an example, at 2 miles per hour. And that's the point at which I start to get short of breath. What could you think of a way? So I still have to get up the hill. So the demand is, and I only have a limited supply. What's a way that I could decrease the demand? Maybe I could walk at 1.5 miles per hour, okay? Now that's not to say keep minimizing your activity, but I'm trying to get you, number one, keep you safe, okay? Because we don't want you getting in the gym. I don't want you going, I have to get up this hill, and then, you do wind up with a problem, okay? But we have to take things one step at a time. It's a big picture plan, okay? Stock markets like this, we don't worry, does it go up or down every day. We look at the big picture. Same thing with your lungs. So you're going to have bad days. No question about it. There's going to be days where weather impacts you. There's going to be days where pollution impacts you. There's going to be days where something bad, when you have mold in your house or something went wrong and you're going to have a bad day. But the goal is the big picture. So how do you stay on track? How do you get back on the horse? And how do you do these different things? So breathing in through your nose, out through your mouth is one way of doing it. Breathing in for a count of 2, out for a count of 4. And you want to try to coordinate that with your activity. Now what happens a lot of times is people will say to me, okay, so I walked to the top of the subway stairs. I didn't stop going up 2 flights of stairs, but boy, when I got out of that subway place, I had to stop. People were coming up to me. They were saying, are you okay? Do you need help? Do you want me to call an ambulance? Now, what is going on there? Okay, that's what you have to ask yourself. Why is that happening to you? So you got up the stairs, right? And again, I'm using going up the stairs as an example. It could be you walked to the corner store. You did your grocery shopping, okay? You did these things. But how do we make it better? How do we make it easier? How do we make it less stressful? How do we make you less anxious? How do we make you more efficient? So let's think about that for a second. So a lot of people don't think about their breathing. They don't think about it until they're short of breath. Okay? So a lot of people also power through things. So, okay, I have to walk the whole block to catch the bus. So I'm going to hold my breath until I actually get on the bus, and then I'm going to get on the bus and I'm going to go. So part of what I want you to do is I want you to get smart about this. I don't want you to necessarily work harder. I want you to get smart about this and think about it. If you're walking in the street, or you're walking on the road, or you're walking in the village or the town, or wherever it is you walk, and you see that there's a hill above, don't wait till you're in trouble to start thinking about breathing, okay? It's like if you're going to the Caribbean, you don't wait to go there and buy a bathing suit. Some people do, but most people will be less stressed if you put it with you and pack it with you. So practice these breathing techniques. Think about what you do ahead of time. Same thing, if you know it's freezing cold outside and you know that cold is what triggers your bronchospasm, then by all means, let's talk about how you can use your medication effectively to make sure that you're going to get outside with the maximum ability to breathe. So again, you're walking, okay, walking up a hill, you're starting to get in a jam. Now let's do some of these techniques. So everybody at home and here, let's just do this for 1 second. So let's breathe in through your nose for a count of 2. You're going to blow out through your mouth for a count of 4. And let's do 3 cycles of that. So let's just start now. So breathe in, and blow, 2, 3, 4. So that's the technique right there. So you've done pursed lip breathing, okay? Ideally, we're going to be doing diaphragmatic breathing. So when you breathe in through your nose, stomach should rise. When you blow out through your mouth, stomach goes in. So now let's just do that one more time. Put your hands on your stomach and let's just focus on the diaphragm. So you're going to breathe in through your nose, diaphragm's going to rise, blow out through your mouth, stomach's going to go in. So breathe in, and blow, 2, 3, 4. So breathe. So that's breathing in through your nose, blowing out through your mouth. When you coordinate it with the timing of it, that's paced breathing. So we've talked about diaphragmatic breathing, pursed lip breathing, paced breathing. Okay? Now I know people are saying, oh, I've been doing this for years, but the key is not in these techniques. And don't get the idea that these techniques are the exercise. So by sitting in your chair and doing this all day, that's not what's going to make you walk uphill more. Okay, in the same way that by giving you an inhaler, that's not going to make your muscles strong enough to walk up the hill. But these are tools that you can use to help do the activity, and that activity itself is what's going to make you do that activity. So your body gets good at doing what you ask it to do. So if you ask it to sit on the couch, flip the remote, and pull potato chips from the bowl to your mouth, that's what you get good at doing. If you can walk a mile today, you can walk a mile tomorrow. And if you can walk a mile tomorrow, you can walk a mile the next day. The problem is, a lot of people take an all or nothing approach. And they say, I'm short of breath, therefore I'm scared to go outside, and I'll spend the whole winter inside. And then springtime comes, and now all of a sudden I can actually get out, but I'm short of breath. I'm not short of breath because my lungs have gotten worse. I'm short of breath because my whole winter of sitting and doing nothing has deconditioned my whole body. Now that being said, some people's lungs could have gotten worse. So don't get the wrong idea and think that I'm saying that, it's not possible that your lungs got worse or it's only the deconditioning. But we have to look at what are the factors that are involved in all these different things. So now, let's go back to the beginning of I'm in a jam. So let's break it down to this. If we could think about, and again, I want to try to make this as simple as possible. So I'm not going to say, what is your blood pressure or what is your heart rate. I'm going to just break it down like this. So if we were to say very, 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 very strong, strong, somewhat strong, and fairly mild. Okay, so let's just think about this. These are layman's terms, okay? So if you think about different activities, okay, think of it like a flight. So any activity that we do, we want a nice, smooth warm up, we want to stay at cruising altitude, we want a nice, smooth landing. In the same way that you don't want a flight that's just going to take straight off, same thing with your breathing and your activity. So a lot of times people don't want to do activities because they're terrified. They're anxious, they're panicked, okay? Has anyone had this experience before? Okay, so you know that once you hit panic mode, okay, and we're talking here about breathlessness. So if I said to you, think about the activities that you do, how would you rate your breathlessness? Or how would you rate your shortness of breath? If you say fairly mild, okay, and I'll just go down here for the sake of completeness and say very mild and very, very mild, or not short of breath at all. So if you're doing an activity and I say, well, how would you rate your shortness of breath? And you say it's very, very mild, great, full speed ahead. So that's telling you that that activity does not have a great demand to it, and maybe for that activity, you don't have to be as focused on your breathing techniques, okay? A lot of times people say to me, when should I do these breathing techniques? And should I do them all the time? It's impossible to do them all the time. It's not a natural way of breathing. And don't get the idea that if you do it enough, that is going to become your natural way of breathing, where all of a sudden you're going, it's not going to happen, okay? This is a tool, okay? In the same way that when you weld, okay, you want to put something over your face to make sure you don't get burnt. Same thing here, okay? You don't sit and watch TV with this welding mask on, okay? Same thing with this. If you want to practice these while you do watch TV or while you're sitting and doing nothing, so that you get the hang of it, and that's, again, the goal. We're not going to start out in the deep end. Start out in the shallow end. Start learning these when you're not in distress. But then think about supply and demand, and that's what we're talking about here. So for most activities, let's say if something is very, very mild, let's say you're, you know, what's an example of something very mild? Anything that you could think of, writing or working on the computer, very mild. You don't have to sit there and go, okay, but as that demand goes up, so in other words, maybe now you're getting up and you're walking across the room, and maybe now your breathlessness is somewhat strong. Okay, but now maybe you have to take the dog for a walk, and now it's becoming very strong or very, very strong. What we don't want, this is like red alert up here. We don't want you to get to the point where it's a catastrophic event, and then you do something that just does, your anxiety gets the best of you, and now we're in code red, because guess what? You're not going to do that over and over again. So if you get into a jam, the likelihood of you having the faith in yourself to go out and do those things again is much less. So we want to try to get control of this down here. So let's go back to code red. You're in the street, okay? All of a sudden it's freezing outside, your airways lock up, your concentrator only provides 2 and you use 4 when you exercise. So now you're wondering if I'm actually getting enough oxygen, and now all of a sudden you become gripped by the shortness of breath, you get paralyzed by the shortness of breath and the fear, right? So you're short of breath, all this adrenaline is coming out, your fight or flight response is going hardcore, and now you're breathing faster. But with breathing faster, you're breathing shallower, and remember what I told you about that. Breathing shallow, we have to get past the windpipe, and if we don't get past the windpipe, remember what I told you about that? Our oxygen's going down, or at least our perception that our oxygen is going down is occurring. So what do you do now? Stop. Talk to yourself before you get to that point. If you can talk to yourself before you get to that point, that's great. But we all know sometimes we don't see it coming, or it comes from out of nowhere, but you still have to talk to yourself. Find it in yourself. Look for that voice that says, stop, I know what to do here. Now we're going to go to, now, if you feel like you have pretty good control, let's say you're in the somewhat strong range, to strong range, or let's say you're short of breath, but it's fairly mild to somewhat strong. I'm going to say, do the controlled breathing technique. So stop. First stop, right? We want to stop adding fuel to the fire. Stopping the activity so we immediately decrease the demand. Now let's talk about increasing the supply. What do? Start breathing. And that went in kind of hard, and I'm now starting to get on. Stop, keep going with it, because it may take a few breaths for you to catch your breath. Do it again. How many people, just even after doing a couple of cycles of that, you can feel the relaxation creeping in? You already feel like you've loosened up a little bit. So you're in a jam, you're walking, all of a sudden I lock up, I'm in trouble. Stop, I know what to do here. Put out the fire, stop adding fuel to the fire by stopping the activity. Because Dorothy, what your question was before, if I'm still walking up the hill, but I'm short of breath and I'm now trying to catch up, it's like I'm trying to tread water, but the water's coming into the boat too fast. You're not going to catch up. You have to plug the hole. Plugging the hole in this case is stopping the activity. Stop, I know what to do here. Breathe in through your nose, out through your mouth. Take a couple of cycles. Now, once you calm down, okay, your anxiety calms down, that adrenaline stops getting kicked out, okay, you are starting to feel more control over your breathing, then you can think about the next step, okay? But my first goal, get you out of a jam. Get you out of that immediate, imminent, emergent situation. And it doesn't matter if it's a real emergency or not. If your perception is that it's an emergency, we're going to treat it as if it's an emergency, okay?
But it's also your contention, and I believe you're right, I understand, don't avoid these issues each day.
So the question is it my contention?
If I know now I'm going home via two methods. One is a street that's uphill,
Right.
or one is level. Which one should I go? Should I definitely go on the incline?
That's a great question. So the question is it my contention that you shouldn't avoid those activities? There's a time and a place for everything, okay? So now, again, and these are the questions I want you to ask yourself. So take stock, okay? The first order of business of really being able to help yourself is to take inventory, okay? And one thing that's a great way of doing this is keep notes. Keep a diary every day. And just say, on a scale of 1 to 10, you wake up in the morning, on a scale of 1 to 10, how is my breathing? How do I feel? And it doesn't have to be that scientific. Subject, how do I feel? Well, I have a little trouble breathing, but it's not as bad as it was the day before. I'm level 7 today. Keep tabs on that, okay? And you can track this to a whole bunch of things. You can say, well, what's the weather? Well, it's 80 degrees and 80% humidity. Well, I know now, based on this thing, that makes it more difficult for me to breathe. Or if it's 20 degrees outside, and, you know, ice cold, and that locks up my airways, then I know that that's one of the things that triggers me, okay? So, but the key is, Dorothy, you have to now take stock. And I'm going to just use your example and I'm going to say this is how I would think about it. You say, I'm leaving the pulmonary center, and there's 2 ways that I could go home. One way is flat, and one way is, you know, an uphill, okay? So now, when we leave here, okay, it's going to be 8 o'clock at night. It's going to be dark. You know there's a lot of gangs down. No, I'm just joking. But, you know, it's dark. It's a little cold outside. The temperatures drop. So maybe this is not the best time for you to say, well, I'm going to get a workout in, so I'm going to take the uphill. You know what I mean? But you don't want to eliminate those activities from your overall life. But look at it as the big picture. Nothing is all or nothing. Nothing has to be done right at this second, right now. So think about, you know, the 7-day week. So if we say we want you working out 5 days a week, then figure it out in the 7-day week. But if you can't do it today, then let's get it tomorrow. It's like saving or spending, okay? Sometimes you have more money to put in the bank than others. So if you're flush all of a sudden, put more in the bank. So if you feel great, do more. If you don't feel as good, or this is a week where you have more expenses, put in what you can. Some days you're going to put in a quarter. Some days you're going to put in a $20 bill. Same thing with your health. So if you're feeling great, ride the wave. But, Dorothy, I wouldn't necessarily say walk outside now and try to get a workout by walking up the hill. Okay, I would say let's find another time, maybe when it's warmer, maybe when, you know, it's bright outside, when there's not going to be other things to look at as well. Because think about it like this. My average patient is 80 years old. Average. That means going up over 100 and going down, you know, into the teens, but average, we're pretty up there. So the other thing you have to think about is, well, maybe I have to worry about stepping on a crack and falling, or maybe you live someplace where the terrain is uneven. So I wouldn't say like, okay, it's dark outside, now's a good time to go out in the field and try to get your workout in. You have to be smart about this. And the thing is that safety is always going to be my #1 priority. Okay, so if it's, I don't know if I can get you through a workout safely, you're not working out. If I don't know if I could go to the store safely, I'm not going to the store. If I don't know if you can swim, you're not going in the pool. It's that simple. You have to use your head. But what I'm trying to do is I'm trying to give you as many tools as possible so that you can start to size this up for yourself. Okay? Now let's talk a little bit, and then I'm going to bring this all back together. So it's you know, there's a lot of information here, but I'm going to make it crystal clear at the end by sewing it all right up. But I have to tell you certain things before we get there. Recovery from shortness of breath, okay? Let's say you're really in a jam right now, okay? We're not at, you know, somewhat strong or strong. We're at very, very strong. This is code red, okay? We got a big problem here. I'm locked up, my airways are tight, I can't breathe. I don't know where my next breath is coming from, okay? What's the first thing you do? Stop. Talk to yourself. Say, I know what to do here. What's next? Think of me. Okay? What's next? We have to stop this fire right at its source. Okay? Now, somebody talked before about this. Let me give you something that is going to be, maybe you've heard it before, maybe you haven't, but this is going to give you a huge amount of knowledge right now. Okay? This is called open chain activity. Okay? So when my arms are free like this is the open chain. And when my chest muscles work in the open chain, they do things like this and this. When my shoulder muscles work in the open chain, they do things like this. When my back muscles work in the open chain, they do things like this. Okay? Why am I telling you this? I don't know. You talk about certain activities that are open chain, they're difficult for you, right? The reason why is because when you're doing these open chain activities, okay, that puts the diaphragm and that puts your respiratory muscles and that puts your thorax in a very poor mechanical advantage, which is why people say, I don't understand this, I'm just brushing my hair. But it's not the act of lifting the brush, it's the act of putting yourself in such an awkward position. And not you, because it may not feel that awkward to you, but for your respiratory muscles and your thorax, okay? So now, here's another concept, the closed chain. How do we close the chain? By putting my hands down, okay? Anybody in this position feel better? Anybody get in this position often? Okay, so let me show you this. When I get into this position, therefore closing the chain, all of these muscles that in an open chain do this, now work in their reverse activity to do what? To elevate the rib cage and help you take a deeper breath, okay? So now we're back to emergency ground zero or red alert. If I'm really in a jam, first thing I want to do, talk to myself. Stop. I know what to do here. Okay? Think of me. Next order of business, close the chain. Okay? So there's a lot of ways that you can close the chain. If you're someplace where you have something to lean on, I'm going to say there's something happens to be right in front of you like this. This closes the chain. And now all of my chest muscles, all of my back muscles, all of my muscles in between my ribs are now helping to elevate my ribs. The other thing that happens here, my abdominal contents fall forward, okay? So sitting over here is the stomach, okay? Sitting underneath the diaphragm is the stomach, okay? And let's say you are overweight. Let's say you have 20 pounds here and 20 pounds here, okay? And now, every time I want to take a breath, I have to lift 2 bowling balls on each side to take that breath. But now look, I'm leaning all the way over. My 2 bowling balls fall forward, clearing the way for the diaphragm to contract downward. When the diaphragm contracts downward, okay, also in the closed chain, this helps to open up the airways. It helps you to take a deep breath. So again, going back to it, okay, I'm really in a jam, I don't know what to do. Okay, stop the activity, talk to yourself, you know what to do here. Close the chain. Here's one way to close the chain. Here's another way to close the chain. Okay, essentially what I'm doing is I'm fixing my upper extremities, I'm fixing my arms. Okay, another way to do it is if you're sitting, okay, come here like this, spread your legs apart. Close the chain right here. See what happens here? My abdominal contents, my stomach, any extra weight around my abdominals falls forward, right? Because here, everything's tight. So if this is all tight, my diaphragm is not going to move down and up very easily. Close the chain. Stop what you're doing. If you have a place to sit down, let your abdominal contents, let your stomach lean forward. Clear the way for the diaphragm. You've closed the chain, giving mechanical advantage to your chest, your back, your shoulders, and now what? Controlled breathing techniques, okay? So I've closed the chain, blow out, Breathe in through your nose for 2, out for 4. Just everybody do this for 1 second. Just close the chain in one direction. So let's do it in sitting. So bring your legs far first before you even lean over. Take a deep breath in and out. Okay, see what that feels like. Now lean forward, okay? Elbows have to be leaning on your legs. So that means not like this. That means you have to lean all the way forward. Let your abdominal muscles go down, or let your abdominal contents in your stomach fall forward. Close the chain. Breathe in through your nose. Blow out gently through your mouth. In for 2. Breathe in, and blow. 2, 3, 4. Does anyone feel that that makes it easier to get that breath in or get that breath out? Okay, so when you're in a jam, again, talk to yourself. I'm panicked right now. I don't know what to do. I'm short of breath. Now adrenaline's pouring out. I'm breathing fast. I'm breathing slow. Stop. I know what to do here. Stop the activity. Stop adding fuel to the fire. Close the chain. Okay, breathe in through your nose, out gently through your mouth. It may take several cycles for you to regain your breathing, okay? But that's a way to do it. So if you're walking in the street and there's nowhere to sit down, lean against the building, okay? You can put your hands on your knees. This is effectively closing the chain, okay? If you need to lean up against the building, this is effectively closing the chain. Now some people are going to say, well, I'm not going to lean up against a building in the middle of the street. I'm not, you know. You're in a jam. This is code red. So I'm giving you the emergency technique now, okay? Get into the breathing again. Breathing in through your nose, out gently through your mouth. Diaphragmatic breathing, pursed lip breathing, pacing the breathing. Once you've cooled off, now it's time to reassess, right? The panic is over. Now we're in control again. And not only that, the more times you do this, okay, you build confidence in this, okay? You don't start off running, you don't start off doing, the high-level stuff. You start off with little successes, and you want to build up little by little. As you feel good, when somebody comes in, we don't start them at level 10 on the treadmill because they never come back. So we start you at level 2. Once you're comfortable at level 2, level 3. Once you're at level 3, level 4. But it's all about building confidence. In the same way that you can spiral downward, again, you can spiral upward. So again, shortness of breath, okay? Happens at high levels of activity. Very anxiety provoking. The anxiety makes you more short of breath. The shortness of breath makes you more anxious. So we want to break into that cycle by teaching you more effective breathing techniques and by exercising you so that your body gets better at using oxygen. Now, these breathing techniques alone are not going to do it. You have to combine them. Okay? So if all of a sudden, you don't walk up subway stairs or you don't walk up a flight of stairs, we'll get to that later, but for now, let's start increasing your activity little by little. Again, most people don't take a sort of calculated, they don't analyze it up and take a very logical approach to it because I can't breathe and it's panic inducing. And at that point, all logic is outside the window. Okay? And again, in the same way that Captain Sullenberger, didn't think about landing in the East River for the first time that day, he practices. He knows these things that go along, and you can do the same thing. So once you're at that point, if you don't know what to do, panic is all over you. But if you can stop yourself, say, I know what to do here, get into that breathing, and that's going to be helpful to you. Now, I promised I would talk about the different diseases and the different patterns. So we talked about in for 2, out for 4. Okay? One of the theories behind why we do in for 2, out for 4 is because with obstructive patients, there's often more difficulty blowing air out. And because there's air trapping, a person can need more time because you're trying to blow air out through a tube, through a straw instead of a tube that's a little bit bigger. But that can work for people with restrictive disease. Now, for people with restrictive disease, they have trouble blowing air in or bringing air in. So there's 2 possibilities that could happen, but it's not just for people with restrictive disease. It's for people with all disease or anyone who's shortness of breath. So if we think of it like this, we have inhalation and we have exhalation. Okay? So we'll start in 2, out for 4. So let's use this as a baseline, okay? If that works for you, great. Go for it. Use it. It's effective. We know it's effective. Now, there's 2 things that could be an issue here for inspiration, right? either that could be too long for you to breathe in, or it could be too short for you to breathe in. Now the reason why I think that breathing in for 2 is not really too long for anybody is because remember I told you have to get past the trachea, right? So if a lot of people get into in, out, in, out, in, out. So they go panting, okay? Panting is never going to work for you. That's why anyone who says, I have to breathe in for 1 and out for 4, that's not going to work for you. It just physiologically is not effective. Now, that being said, if somebody came to me, they couldn't get what I was telling them for whatever reason, it just didn't work and that was the only thing they could do, I would say, go right ahead, do what you're going to do, okay? And then little by little, we'll try to get them to experiment with other things, but that's what I want you to do, on your own. Now, the more control you have of your breathing, the greater chance you're going to have, and I'm just giving you suggestions here. Try them all, okay? You have nothing to lose. I'm not selling them to you. They're all yours. I'm going to give them to you right now. Try them all out. Whichever recipe you like best, by all means, use it. But if you have more control of your breathing, okay, or if you're in better shape, breathing in for 2 and out for 4 might be too short for you. Okay, and if you're really working out pretty vigorously, you may not feel like you're taking a deep enough breath in because you're going in, right? So you are getting air into your lungs, but maybe what you're doing, and maybe you have more control, but maybe in, out for 6, okay? So that's an example of one thing that you can try. Now somebody's going to say, well, I can't blow out for 6. So I could breathe in for 3, but I can't blow out for 6. Well, we have a solution for that. -1. Try breathing in for 3 and out for 5. And you can do this in any way you want. You could say, try breathing in for 2. You could say, I can breathe in for 2 and take a deep breath, but 4 is not enough for me to blow all the air out. So then it's in for 2, out for 5. Now for the restrictive patients, or people with pulmonary fibrosis, interstitial lung disease, that's a little trickier because sometimes getting that deep breath in is the problem. So for people with restrictive disease, it's like trying to blow up a hot water bottle, okay? I think back to the 70s when Jack LaLanne would show how strong he was he'd blow up a hot water bottle, and that's what trying to inflate the lungs of somebody with a restrictive disease is like. It's like the lungs are resistant to taking the breath in, but then they recoil very, very quickly, okay? So that naturally is going to decrease the expiration, okay? But what I would try to do is I would try to prolong the inspiration and, I would try to make it as long, both on inspiration and expiration as you can, but in some cases you're going to be limited by the recoil of your lung. So you can't take a deep breath in. If you could breathe in for 2 and out for 3, I would say that that is probably going to be easier for you because in for 2, out for 4, your lungs may not stay open in order to get to 4. But again, I'm not telling you this to say, here's the exact thing that you should do. I'm saying these are the possibilities. Not all things are for all people. Not everything works for everybody. Most things don't work for, work for a lot of people, but nothing works for everybody. So you have to try it out. Don't write me emails, or you can write me emails and tell me what I said wrong or whatever. But please understand, I'm trying to give you a range of spices here. Okay, you may not like as much paprika. You may want more garlic. Okay, but try these different things out. At least understand the concept behind them. Now let me just talk about one more thing before we break, and then I'll take a couple of questions. Chris, do we have questions from outside? Okay, so I'll take questions from here. People have them. I'll take a few questions from outside. But now let me put this whole big thing together for you, okay, in one paragraph. So we talked about shortness of breath. It doesn't matter if you have obstructive disease, restrictive disease, pulmonary hypertension, heart disease, lung disease, out of shape, obese, bad hip, which led you to be in bed for a week, or any millions of different things. Shortness of breath is shortness of breath. And my friends at the American Lung Association say, if you can't breathe, nothing else matters. Okay, so if you're listening to this webinar, you know that I'm telling the truth. Okay, so it doesn't matter what is causing your shortness of breath. We want to teach you how to breathe better and then start addressing those issues one by one. Now, if you got short of breath, or you had pneumonia and you're in the hospital for a month, and you haven't been outside in 2 months, then you're not going to go from level 1 to level 10. But every little bit that you do is working you back towards the things you do. So again, think of the cycle. Shortness of breath leads to eliminating the activities that cause that shortness of breath. All of the muscles that you use to do those activities get weaker. They don't use oxygen as well. So you start to get short of breath at lower levels of activity, and you eliminate those, and so on and so forth. Again, it's possible for all that to happen with your lungs not getting any worse at all. So then we know your disease is not getting worse. You feel more short of breath, but maybe your disease is stable. So now let's address those other issues. So if it's that you gained 20 pounds, let's start at Weight Watchers and start working on losing some of that weight. If it's that you become less active because you're putting in more hours at work, let's figure out a way so you can take a half hour during the day and increase some of that activity. If it's that you're not eating as much because you have acid reflux and so now you're not getting enough nutrition, let's figure out how to address that acid reflux. But you see that all these things, the hip bone is connected to the knee bone, is connected to the ankle. Well, the lungs are connected to the heart, are connected to the muscles, are connected to all these different things. And so a problem in one area can lead to another area, and it's not always what's right in front of your face. You know what I mean? It's like you say when you hear, footsteps, we don't think zebra, we think horses, but sometimes it's a zebra. Everybody's different. And so a lot of times, there's a great book, I think it's called How Doctors Think, and they say that very often, a patient has something like 20 seconds before they get, interrupted for the first time by the doctor. So you come in, you say, well, what's wrong with you? 20 seconds to say what you want. And another thing they say is that often the first complaint is not even the most important complaint. So in order to figure out what's going on, you really have to look at the big picture. You really need somebody who's going to say, well, what's changed? Has your diet changed? Have you gained weight? Is your pulmonary function getting worse? Is your heart getting worse or better? But really, let's try to address what is really the problem. So if you've gained weight and you're now 20 pounds heavier because all winter you just sat inside and ate and didn't do any activity, then let's not treat that with an inhaler. Let's treat that with weight loss and activity. But again, we have to break into these cycles, and there's a lot of cycles. So it's shortness of breath, eliminate the activities, get weaker, get more short of breath. Let's break into that cycle by teaching you more effective breathing techniques and exercising you so that your body gets better at using oxygen. There's the shortness of breath anxiety cycle, right? But if I all of a sudden say to you, you don't know how to swim, but now I put you on a float, you say, well, I'm floating. That's confidence building for you. So let's break into that cycle by telling you, by starting to come up with the concept that you know what to do here. So now again, just one last wrap up. So you're in a jam, I'm walking in the street, it's cold outside, ugh, my airways lock up. So already I'm taking less breath in with me, right? But I still have to get up that hill, and now I'm struggling, right? Now it's getting to the point where I'm getting less and less air with each breath. Maybe my oxygen's going down. If it's not going down, it feels like it's going down. We need to cut off all fuel supply to that fire. What do? Stop. I know what to do here. Think of me. Close the chain somehow, okay? Stop right here, close the chain, let your chest muscles, your back muscles, all your thoracic muscles work in their reverse activity. Drop your abdominal contents down so that your diaphragm has a nice clear path. Controlled breathing techniques. In through your nose, count to 2 or 3 or 4, whatever you like. Don't send me hate mail because you don't like my ratio. Out for 4 or 5 or 6. Catch that controlled breathing. And then the other thing somebody would say is, what about my inhaler? Should I take my inhaler? And the answer is, maybe. It depends what your inhaler is. Next month we're going to talk about medication use, and we're going to go right back to this whole thing, and I'm going to teach you how do you use your medications to maximize all this. How do we not even let the fire get going, okay? Every time we see an ember, we want to put it out, okay? So next month is going to be kind of unique. I know that people come to me all the time, they're confused about their medications. They have 3 different inhalers. They don't know the differences between them. They don't know how to take them. They don't know that if you change the order or, blah, blah, blah. There's a lot of ways you could go wrong with your medication. So when people come in and say, well, I take Spiriva and Advair and I supplement with Zopinex, but I don't think they're working for me, I always say, well, let's sit down and figure out how are you using them. Because if I have a headache and I take my Tylenol but it never goes in my mouth, or then it's not going to help my headache much. Same thing with the respiratory medications. So one of the ironies about respiratory medications is that for the people that have the most difficulty coordinating breathing, all these medications require you to coordinate your breathing very well. So it's coordinating the actual act of taking the medication, knowing what you're taking, why you're taking it, what are the differences between them, and what's going to help you in a situation, and what's going to be totally useless to you in a situation. So in other words, if you take a Flovent, which is a steroid, you could pump that whole thing in your system. That's not going to get you out of a jam, okay? So that's what I want to cover next month. In addition to, I want to teach you how do you set up your day so that you get maximal bronchodilation, meaning that your lungs are as free and open as possible, and then how do you keep that all day without going up, down, up, down, up, down. Questions? Any questions from home?
Yes, we have one over here. What is the number that your oxygen level should never go below under exertion?
Okay, so what is the level that your oxygen should never go under exertion? Okay, so does anyone know the answer to that? No. All right, so let me teach you about oxygen saturation in 1 minute. I'm going to give 1 minute to every question. Okay, I'm going to try to make it real simple, but I'm going to give you a 1 minute primer. So we have a number, okay? Everybody thinks 90, 91, 89. If you look at the literature, and you know, there's different ways of how people know what is okay. So there's a few things you need to understand. When we talk about oxygen saturation is an indirect measure of the level of oxygen that's in your bloodstream, okay? So what you need to realize, though, is that a lot of people think that this is how oxygen is, okay? So if this is the ratio, or this is the graph that describes how much oxygen you have, so here's a lot of oxygen, here's not a lot of oxygen, this is very predictable, and what that means is that every number, so starting at 100%, 99, 98, 97, 96, blah, 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 all the way down, is equal. Right? Except that's not the case. So if that were the case, we could say, okay, 90 and 91 and 89 are all about the same. Except that in reality, okay, and it's really kind of a warped reality because you would never know this unless some people were like geniuses and figured this out, but there's something called the oxygen, oxyhemoglobin dissociation curve, okay? And what that means is that if we start out up here, okay, and that's 100, and that's 90, essentially. So what most people will say is 90. I don't want you at 90, okay? And I'll tell you why. This is kind of how your body gives up oxygen in the bloodstream, okay? And it's a super complex topic, even for clinicians. But the point is that something happens at 90, okay? So if you notice at the top here, okay, between 90 and 100, it's kind of flat. But look at what happens here at 90. You see how there's this giant dip? So let me just say it like this. You are on vacation. The person you are with wants to take your picture, okay? So you start off at 100, and they go, no, back a little further, back a little further, back a little further. You could go back 10, but if you go back 11, you're going over the cliff, okay? Same thing with your oxygen. And that's why when somebody says, oh, 89 is not a problem, or 88 is not a problem, they're thinking about it, meaning that all of these numbers are actually equal when they're not. So there's in fact a greater difference going from 91 to 89, okay, which is only a difference of 2% in oxygen saturation, but there's a greater difference in that than going from 91 to 100, okay? So that's a lot of science, but now let me answer the question, okay? I don't want somebody at 90 because listen, I've been on mountains where there's like 6 inches and you kind of have to lean back because if you lean forward, you're going over the side of the mountain. I don't want you where you have to be like this, oh, I'm at 90, I hope I don't go to 89 because then, okay? I want to keep people way above that. And that's where, you know, there's so much of a topic here. I mean, this is all about, well, what concentrator do I use? How many liters should I use? Do I need a pulse oximeter, okay? If you look at a lot of rehab programs, I'm going to tell you my philosophy on oxygen. We probably use more oxygen than anybody else. And the reason is because my philosophy is not, well, I want to keep you at 91%, therefore I'm going to keep your workout lower in order to keep you well saturated, right? Because remember what I told you? I told you that your body gets good at doing what you ask it to do. So in other words, if I keep you at level, you know, if this is the level that your life requires, and I exercise you at this level, you could do that till the cows come home, and your life never gets better, right? And so if I'm going to keep you here, because anything higher than that brings you below 90%, you don't need me, okay? So what I'm going to do is I'll give you oxygen. Even if you never wear oxygen anyplace else but rehab, I'll give you as much oxygen as it takes for you to stay saturated so you could get the biggest workout, because it's that big workout that's going to actually make your body better at using oxygen. So a lot of people come, they've never used oxygen before, and they think to themselves like, oh, well, I don't want to use oxygen, I don't want to become dependent upon it, I don't want to need it sooner, blah, blah, blah. And those things don't happen. You don't become dependent on it by using it earlier. It doesn't mean you're going to need it sooner. What it means is that we're tricking your body into getting this giant workout, and your body doesn't know that it's using oxygen. All it knows is, I better get my ass in gear because I need to do this regular workout, okay? So, short answer, there are going to be different people. It's too late for the short answer. Let me just say this. Go back to the long answer. So what number should it be? I want people 93 plus, okay? In order to qualify for Medicare to get oxygen, I think you have to demonstrate that the person's either at 89% or 88%. But again, do you really want, do you want to be on the verge of a problem? No. I'd rather give you some leeway. So whatever it takes to keep you 92, 93. Now, does that mean if you go to 90, it's the end of the world? No. And in fact, for people with lung disease, they can sometimes tolerate, a lower saturation because it happens over time. But here's one other thing to keep in mind. Most pulse oximeters have a plus or minus of 3% error, right? So that means if you're at 90, okay, and it's reading 90, maybe you're at 93, but maybe you're at 87. So with that in mind, I always want to make sure that even with the worst error rate there, you're still going to be covered. Any questions about that? Chris, do you have any more questions?
Is there a treatment for pulmonary hypertension?
Is there a treatment for pulmonary hypertension? The answer, definitely. Okay? So let me talk about pulmonary hypertension a little bit. I'm going to give you guys, if anyone has to leave, I won't get insulted, but I'm going to give you like 8 to 18 more minutes depending on questions. So pulmonary hypertension is one of my favorite, not favorite things, but it's one of my most interesting. It's something that I'm very interested in because pulmonary hypertension falls into one of those categories that most people are terrified of it, okay? People with pulmonary hypertension are very short of breath. They have oxygenation issues. There are, certain types of pulmonary hypertension that could be very, very dangerous to you. And so as a result, people treat people with pulmonary hypertension with kid gloves, okay? So you better rest, you better do this. Now, are there treatments? Let's talk quickly about what is pulmonary hypertension. So here's your heart. This is the left side of your heart right here. So this is your left atrium. This is your right atrium, right ventricle, left ventricle. So under normal circumstances, the left side of the heart is the high pressure side of the heart. And the reason for that is because the left side of the heart is going to pump blood all over the body. So it has to be strong to deliver blood far and make sure that it comes back. The right side of the heart is the low pressure side of the heart because that only has to pump from the heart right over here to the lungs, okay? So if you have hypertension, it's systemic hypertension, that means you have high blood pressure and the left ventricle has to work harder to overcome that resistance. When you have pulmonary hypertension, so you have your right ventricle, then you have what's called your pulmonary valve, and then you have your pulmonary artery, and then that leads to the lungs. So when you have pulmonary hypertension, this artery becomes tighter. The pressure on the right side becomes tighter, making the right side of the heart work harder. And the problem with that is that normally you have a high pressure side of the heart and a low pressure side of the heart. Now everything's high pressure. So are there treatments? There are definitely treatments. There are, what am I trying to say? There are vasodilators. There's a lot of treatments. Pulmonary hypertension now is where lung disease was like 10 years ago, which is that all of a sudden people are catching on because more people are being diagnosed and people are getting excited about the treatments. So it's not the same as treating hypertension. So if you have pulmonary hypertension, my recommendation is always going to be to see a specialist who really is a cardiologist usually who specializes in pulmonary hypertension. But I want to talk specifically about my area, which is exercise and pulmonary hypertension, okay? Because I believe exercise is going to help everything. I've been to so many conferences where they say that for patients with pulmonary hypertension, they can exercise, keep them at a maximum heart rate of 120, okay? So if somebody says to me about anything, they say any disease, COPD, hypertension, pulmonary hypertension, and they say the max heart rate is 120, I know that that means that they don't really understand the disease process. Okay? And the reason why I say that is because I have patients who are 75 with pulmonary hypertension, and I have patients who are 30 with severe pulmonary hypertension. And there's no way that you can make a case that somebody who's 75 has to have the same max heart rate as somebody who's 30. So we're actually involved in a study right now at our center, which is to talk about the safety of exercise with pulmonary hypertension. And again, in the same way that it improves lung function, I think that the effect of exercise is it improves cardiac function. It also relaxes the blood vessels and hopefully can play some impact in helping with the medication to improve pulmonary hypertension. But people say, but it's so dangerous. How do you exercise these people? And it's the same thing I said before about my pulmonary patients, which is that regardless of your disease, I am looking at everything every 5 minutes. I see your heart rate and rhythm. I see your blood pressure every 5 minutes. I'm checking your oxygen. I can give you more oxygen to relax the blood vessels a little bit. So is there treatment for pulmonary hypertension? There's a lot of exciting treatments going on now. Some of them are lifestyle issues like exercise, nutrition, things like that. But again, if you have pulmonary hypertension, that's not run-of-the-mill. Okay? The majority of doctors don't know a whole lot about it. I mean, I know people who that's all they do. So if you get pulmonary hypertension in New York City, you're going to 1 of 3 people. Okay? And those people have been the most successful. But pulmonary hypertension is not an easy disease. Not that lung disease is, not that heart disease is, but it's tricky. So you want to go to a center that specializes in pulmonary hypertension or a cardiologist specifically that specializes in pulmonary hypertension. We have more questions? Any questions from the in-house audience? Okay. Yes?
I have a question about places that have, I hope this is not topic, that they burn, you know, heaters. It's cold and they want to get it very, very warm. And it outgasses something.
Yep.
And suddenly everything has changed.
Absolutely. So the question is, what about places where, you know, it's cold and they want to make it very, very warm, so they burn a heater and, you know, it outgasses something? I mean, let me just say this. Again, everybody's different. Okay, so it's like food allergies. Some people are allergic to broccoli, some people are allergic to avocado, some people are allergic to shrimp. Remember how before I said there can be a problem in any of these airways, and I talked about the itis, which is inflammation, right? So bronchitis is inflammation of the bronchi. Laryngitis is inflammation of the larynx, okay? But let's say, you know, Pete, you work in a coal mine. You're a farmer, and you're around a lot of things like hay or seeds that are getting chopped up. Or you are in New York City in summertime and one of the big buses goes by. I mean, we've all had the experience where we're standing on the corner, a bus goes by, and we know that we can wipe off whatever just blew out of that bus onto us, okay? So the problem is that that can create inflammation anywhere along this airway. So it can make your nose stuffy all of a sudden, okay, in the same way that if you're allergic to cats, it's going to make your nose stuffy all of a sudden. It can make your throat tight. All along the airways, you have smooth muscle inside, and that could be enough. Now, ideally, in an ideal world, I talked about the nose filtering this stuff out, but depending upon the insult, okay, you know, it may not, in all likelihood, it's not going to be able to filter out something like that. Same thing, that stuff can hit your airways, and it can automatically cause a bronchospasm. Why is it causing a bronchospasm? Because your lungs perceive the threat. They want to shut the door down before that stuff really gets in where it could be, but that's a problem for you. So, you know, you have to avoid these things. So if you know your triggers, that's another big thing. When it comes to people who are asthmatics or asthmatic bronchitis or anyone who's subject to this airway irritability, you need to really avoid those triggers like the plague. And you say, well, you know, every time I go to the Met, you know, the seats smell kind of, I'm not talking about the Met, I take it back, that was an example, but there's a theater down the block where the seats are really dusty. If I know every time I go there, even if my favorite movie's playing, I get, you know, all inflamed and it takes me a couple of days because now my body's producing mucus to try to protect me, you need to avoid those triggers at all costs. I'll take one more question. Chris?
Why is sleeping on my back uncomfortable?
Why is sleeping on your back uncomfortable? Okay, so I will start off by saying I don't know who you are, and so I don't know. But let's think about some possible reasons why, okay? There are going to be, remember we talked about there's going to be certain positions that are going to be more beneficial for breathing. So as an example, if we think about the lungs, so when you're in the upright position, as a general rule, fluid wants to go down and air wants to rise, okay? And this is one way of describing this. There's many other ways we could describe it, but in the upright position, more blood is going to be at the bottom of your lungs and more air is going to be upright at the tops of your lungs, okay? And that all changes based on position and gravity. So for example, if I were all of a sudden, and this is not anatomically correct, but I'm going to use it as an example anyway. So here's my right lung. So you could see that if I just told you that when I'm in the upright position, all the blood is going to go down and all the air is going to come up, right? Everything shifts when we turn it this way. So when you think about it like this, the left lung, okay, that is down, is now going to get more blood flow, and the right lung that's up is now going to get more air. So as an example, if you have a right lower lobe pneumonia, then you might want to sleep on your left side so that mucus can drain out, okay? But if you know, there's other situations why you're not. Now, I don't know why lying on your back for you is a problem, but let me talk about a couple of things related to sleep. Okay, for some people, okay, and I'm not diagnosing anybody right now, but in the same way that I said this allows your abdominal contents to drop down, clearing the way for the diaphragm, when you lean back, guess what? Your diaphragm is way up there, okay, and it's putting it at a poor mechanical advantage for breathing. Another thing, and two of the questions that I ask people when I see them for the first time are, when you lie in bed at night, are you able to lie flat? And do you wake up in the middle of the night short of breath? And the reason for this is because in some people, and the thing that we're getting at with that is there any degree of heart dysfunction? And again, at home, don't panic. I'm not saying you have a heart problem, but for some people, especially people with congestive heart failure or things of that nature, when you lie flat, the heart has to work that much harder to pump blood. And so if that left ventricle is not able to do its job properly, blood can actually back up into the lungs where it's going to make you more short of breath. Again, without speaking to you individually, doing some testing, looking at you, watching you, there's no way to give you a direct answer, but there are multiple. It could be positional, related to the mechanics of the diaphragm. If you have a regular pattern where when you lie flat, you start to get short of breath, I would consult my physician about that, and I would really want some type of cardiac workout. Yes, sir?
Why does a chiropractor tell you to go to sleep on your side? And, like, put your arms relaxed, and that works out great.
Now, is that specific for pulmonary disease? So the question was, why does a chiropractor tell you to lie on your side?
It's like muscles at the bottom and so forth. And then with your body totally extended, you could sleep like that all night.
Sleep is a really funny thing because, I'm one of those people who really has a challenge to sleep. Why you don't sleep well can have there's a million reasons why. If we get 20 people in a room and none of them sleep well, and we try to really assess why they don't sleep well, we could come up with 20 different reasons. Each one will be different for, each person. And the other thing to think about is that there is something called sleep apnea, where during the night people start, have periods where they actually stop breathing, and then they wind up waking up short of breath. And that's another thing. But if you have a consistent problem breathing when you sleep, that's something, there's something called a sleep study, where you actually go in and you're hooked up to, all the monitoring equipment to make sure that that there's no issues. And that, you find out about the heart in that way, you find about the lungs, you find out about, the respiratory system. So if you have a consistent problem sleeping, and it's related not to your back being sore, but to shortness of breath, then that's something I would really want to discuss with my doctor and have worked up. It's 7:54. I'm going to do 6 more minutes if there's more questions. Are there more questions? Let's roll with it.
What are the best ways to clear mucus obstructions?
Okay, so what are the best ways to clear mucus obstructions? That is not a 6-minute topic, okay? We're going to actually have a whole session later in the series about how to keep your lungs clear and free of infection, but let me just give you one basic thing, okay? Mucus falls more in the category of fluid than air, right? So remember what I told you. So let me tell you something else. The cough mechanism is only effective from here, which is the point at which the trachea splits into the right and left main stem bronchi, so the cough mechanism is only effective from here up. What does that mean? That means if you have mucus, and think about it, if I'm upright, gravity is going to bring that mucus down, right? So here's my lungs, again, not anatomically correct, but if that mucus is down here, I can cough till the cows come home, I'm not going to clear. So let's say my mucus is here. So it's like the same thing, like if I have ketchup, I want to get ketchup out of this bottle, I'm not going to hold it up like this and shake it. But what are we going to do? We're going to tip it, right? So if you have mucus in your right lower lobe and you lie on your left side, well, guess what? Now, gravity is going to help with that. We also know what direction each of the bronchi point, and there are actually positions for each lobe and each segment of the lungs. And later on this year, we're going to have my colleague for 20 years, Marion Macklis, who is the chief of our airway clearance unit, who's going to do a whole session about how to keep your lungs clear of infection, how to bring up mucus. Next question.
What is the best way to exercise with oxygen, bicycling or treadmill?
Okay, that's a good question to end on. So what is the best way to exercise with oxygen, bicycling or treadmill? So if the answer is both. But here's the thing. Remember I said again, your body gets good at asking it at what you ask it to do. It gets good at doing what you ask it to do. So being that most of us don't travel by bike, particularly recumbent bike, I'm always going to say the treadmill. If I have one piece of equipment, the treadmill, I could still get patients into the exact same physical condition as I could get them in using 6 different machines. If I just have a bike, I cannot. Okay? Now there are some reasons why somebody can't do a treadmill and they would do the bike. If it's all you've got, it's better than nothing. Okay? But I still think walking and treadmill are going to be better. And again, think about it like this. In the bike, a lot of your body weight is supported. Okay? When you're upright, you are standing. Even if you're standing doing nothing, we're still balancing muscles between forward and back, front and back, left and right. So to me, the treadmill is always going to be my main source of exercise. And the other thing about treadmill versus bike, it's hard to control bike. Okay? It's hard to make you go at a certain RPM and keep it steady. With the treadmill, I'm controlling the buttons. Okay? So I know what speed you're walking at. I know what incline you're walking at. And I'm going to end with just one more point that question led me to. And people say this all the time. They say, I don't understand this. When I come to rehab, I can walk on the treadmill for 20 minutes, and then I can't walk a block in the street. So remember what I told you before about open chain, closed chain activity, right? So treadmill is closed chain. So number one, you're getting some benefit from that, being that your arms are fixed. So, may I borrow this as a, so I keep a fleet of these, and so I'm going to hold it up so people can see it. So I have a lot of people say, I can't walk half a block outside, but I can walk 20 minutes on a treadmill. And I say to them, the reason is because you're doing open chain activity, but if I just give you something like this, guess what? All of a sudden those people go out and walk 5 blocks, okay? So I know a lot of people resist a walker, okay? It's not the be-all and end-all, but guess what? If that's how you get around, and that is the bridge to getting you doing those activities again, by all means, you know, I think of our program as, you know, Malcolm X pulmonary rehabilitation, meaning by any means necessary, okay? There's nothing we won't try to do if it's going to scientifically get you back to doing the things that you want to do. But we have to do it smartly, you know what I mean? And we have to look at every person individually. You know, there are programs where you go in and there's one therapist and 8 patients exercising, and there's no way those patients can get the exact right workout for them because it just can't be, okay? We really have to look at the individual. We have to lay out what is it that's truly causing you the problem. And, you know, whatever it takes to start working you back along the road to health, that's what we're going to do. So I'm going to end here. That's quite a long time, but what I'm going to say, thank you all for attending. I thank the American Lung Association, as usual, for their support as our Better Breathers Club partner. I thank the Lung Connection for helping us get the word out, and all the list of people who, I'm not going to say the whole list now because I don't want to forget somebody and then get some email about it, but we thank you all. I ask that if you feel that this has been beneficial to you, please spread the word, post it on websites, post it on whatever support group you're at. You know, there's plenty of people out there with lung disease that could benefit, and you know, I don't care whether it's the foundation or the association or the society or this or that. We're not looking to compete with anybody. We're not looking to discriminate against anybody. If the information is beneficial, we'll share it with anyone who needs it. The other thing I'll just say, I'm going to send you an email later begging you for money, not for myself, but my team is doing a 55-flight stair climb this weekend to benefit the American Lung Association. If you found this helpful and would be so kind, I would appreciate it. No pressure whatsoever. But other than that, the next 2 weeks is going to be Q&A period. So next Wednesday, 7:30, it's only going to be online, but it will be an all question and answer series where you can call in and ask questions. Next week is going to be easy breathing, which is going to be more basic, meaning for people who are new to lung disease or people who really want to review the basics. And the week after that is going to be deeper breaths, which is going to be people who have had more time to experience lung disease or who want to talk about more complex topics. I thank you all for coming. Spread the word. Breathe easy. Stop. You know what to do. Deep breaths in through your nose, out through your mouth. Fix, eliminate the source of fire. Have a good week. Thank you very much.